Today, we're going to talk about rheumatoid arthritis. It's a chronic inflammatory disorder that can affect more than just your joints. The condition can damage a wide variety of body systems, including the skin, eyes, lungs, heart, and blood vessels. It is an autoimmune disorder that occurs when your immune system mistakenly attacks your own body's tissues. Unlike the wear and tear damage of osteoarthritis, which is a type of arthritis caused by inflammation, breakdown, and eventual loss of cartilage in the joints. Rheumatoid arthritis affects the lining of your joints, causing a painful swelling that can eventually result in bone erosion and joint deformity. The inflammation associated with rheumatoid arthritis is what can damage other parts of the body as well. While new types of medications have improved treatment options dramatically, severe rheumatoid arthritis can still cause physical disabilities. Signs and symptoms may include tender, warm, swollen joints, joint stiffness that is usually worse in the mornings and after inactivity, fatigue, fever, and loss of appetite. Early rheumatoid arthritis tends to affect your smaller joints first, particularly the joints that attach your fingers to your hands and your toes to your feet. As the disease progresses, symptoms often spread to the wrists, knees, ankles, elbows, hips, and shoulders. In most cases, symptoms occur in the same joints on both sides of your body. About 40% of the people who have rheumatoid arthritis also experience signs and symptoms that don't involve the joints. Rheumatoid arthritis can affect many non-joint structures, including skin, eyes, lungs, heart, kidneys, salivary glands, nerve tissue, bone marrow, and blood vessels. Rheumatoid arthritis signs and symptoms may vary in severity and may even come and go. Periods of increased disease activity called flares alternate with periods of relative remission, when the swelling and pain fade or disappear over time. Rheumatoid arthritis can cause joints to deform and shift out of place. See your doctor if you have persistent discomfort and swelling in your joints. Rheumatoid arthritis occurs when your immune system attacks the synovium, which is the lining of the membranes that surround your joints. The resulting inflammation thickens the synovium, which can eventually destroy the cartilage and bone within the joint. The tendons and ligaments that hold the joint together weaken and stretch. Gradually, the joint loses shape and alignment. Doctors don't know what starts the process, although a genetic component appears likely. While your genes don't actually cause rheumatoid arthritis, they can make you more susceptible to environmental factors, such as infection with certain viruses and bacteria that may trigger the disease. As you can see in the picture, a fixed joint and a bacterial infected joints. Factors that may increase your risk of rheumatoid arthritis include your sex. Women are more likely than men to develop rheumatoid arthritis. Your age. Rheumatoid arthritis can occur at any age, but it most commonly begins in middle age. Family history, uh, the heredity. If a member of your family has rheumatoid arthritis, you may have an increased risk of the disease. Smoking. Cigarette smoking increases your risk of developing rheumatoid arthritis, particularly if you have a genetic predisposition for developing the disease. Smoking also appears to be associated with greater disease severity. Environmental exposures. Some exposures, such as asbestos, which is a highly heat-resistant fibrous silicate mineral that can be woven into fabrics and is used to break linings and in fire-resistant and insulating materials, or silica, which is a hard, uncreative, colorless compound which occurs as the mineral quartz and as a principal constituent of sandstone and other rocks. They may increase the risk of developing rheumatoid arthritis. Emergency workers exposed to dust from the collapse of the World Trade Center are at higher risk of autoimmune diseases such as rheumatoid arthritis. Obesity. People, especially women aged 55 and younger, who are overweight or obese, appear to be at somewhat higher risk of developing rheumatoid arthritis. Rheumatoid arthritis includes the risk of developing osteoporosis. Rheumatoid arthritis itself, along with some medications used for treating rheumatoid arthritis, can increase the risk of osteoporosis, which is a condition that weakens your bones and makes them more prone to fracture. Rheumatoid nodules. These firm bumps of tissue most commonly form around pressure points, such as the elbows. These nodules can form anywhere in the body, including the lungs. Dry eyes and mouth. People who have rheumatoid arthritis are much more likely to experience Sjogren's syndrome, which is a disorder that increases the amount of moisture in your eyes and mouth. Infections. The disease itself and many of the medications used to combat rheumatoid arthritis can impair the immune system, leading to increased infections. Abnormal body composition. The proportion of fat to lean mass is often higher in people who have rheumatoid arthritis, even in people who have a normal body mass index. And by the way, you can calculate your BMI online and see if you are overweight or overweight and so on. Corporal tunnel syndrome. If rheumatoid arthritis affects your wrists, the inflammation can compress the nerve that serves most of your hand and fingers. And heart problems. Rheumatoid arthritis can increase the risk of hardened and uh, blocked arteries, as well as inflammation of the sac that enclose your heart. You can also receive lung disease. People with rheumatoid arthritis have an increased risk of inflammation and scarring of the lung tissues, which can lead to progressive shortness of breath. Lymphoma. Rheumatoid arthritis increases the risk of lymphoma, which is a group of blood cancers that develop in the life system. Rheumatoid arthritis can be difficult to diagnose in its early stages because the signs and symptoms mimic those of many diseases. There's no one blood test or physical findings to confirm the diagnosis. During the physical exam, your doctor will check your joints for swelling, redness, and warmth. He or she may also check your reflexes and muscle strength.
Okay. One one thing that they can do for um, to diagnose retinoid arthritis is a blood test. What they do is they look out for some things that may indicate inflammation, such as the ESR and the C-reactive proteins, and these may indicate the presence of the inflammation in your body. Other common blood tests look for rheumatoid factors and anticyclic citrullinated peptides antibodies. They look for specific antibodies that may tell us that rheumatoid arthritis is present. Next slide. Another thing that they can do is they could have an X-ray over the affected part. Let's say, for example, the knee, and they can see that there is rheumatoid arthritis in the joint. MRI and ultrasound tests can help your doctor judge the severity of the disease in your body. So one of the main diagnoses is having an X-ray or an imaging test to see if your knees or the specific joint is affected or not. There is no cure specifically for rheumatoid arthritis, but clinical studies indicate the remission of symptoms is more likely when treatment begins early, um, with medications that they call DMARDs, and I will talk about them later. But they just suppress the immune system and the inflammatory system. So I'll talk about it later. Next slide. Medications that they can use. One thing is NSAIDs, and these are non-steroidal anti-inflammatory drugs. What they can do is they reduce inflammation and relieve pain, and that let's say you have rheumatoid arthritis in your knees. and they just reduce the pain, basically. They are available by prescription, and there are some light side effects such as stomach irritation, heart problems, and kidney damage. Another thing is corticosteroids medication, and these can just reduce inflammation and relieve pain and slow joint damage. They just slow down the process. Side effects may include thinning of bones, weight gain, and diabetes. Doctors often prescribe a corticosteroid to relieve acute symptoms with the goal of gradual tapering off the medication. So basically, just reduce inflammations, medication that reduce the inflammation. Next slide. But these don't actually solve the issue. The thing that I was talking about earlier, the DMARDs, and these drugs just like we know that autoimmune diseases is when the cells of your own body becomes the antigens that the immune system is trying to kill. Usually, the immune system is good; it fights off viruses. But when it's attacking the own cells, you don't want it to actually be working and attack your own cells because it's damaging your body. And so, what you want to do with these drugs is these drugs suppress the immune system and the inflammatory system, and they save the joints and other tissues from permanent damage. Side effects vary, but include liver damage, bone marrow suppression, and severe lung infection. So, as I said, they just try to suppress the immune system. Another thing is biological agents, also known as biological response modifiers. These are like newer class of DMARDs, DMARDs. I don't know if they actually do say the pronunciation. Um, these drugs target parts of the immune system that just trigger inflammation, and that causes joints and tissue damage. So basically, just like DMARDs, um, they suppress the specific immune system. They're just like more specific than the one above. These types also increase the risk of infection, um, which actually makes sense because if your immune system is being suppressed, technically your immune system is not strong enough to fight off things that actually needs to be attacked, such as viruses and bacteria. So that's just a heads up. That's why it's so like like it's a confusion in your immune system and it can cause lots of problems. Um, yeah, that's it. Next slide. Another thing that people do is therapy, um, to keep just like in physical shape. Your doctor may send you to a physical or occupational therapist who can teach you exercises to help keep your joints flexible. As we know, this disease mainly affects the joints, so making sure that your joints are flexible and having some physical therapy to just make better condition of your knees or your joints in general. The therapist may also suggest new ways to do daily tasks, which will be easier for your joints. So just a coping mechanism, like things, maybe some actions like hurt your knees, like hurt your joints even more. Um, he might give you another way of doing those certain activities, such as make like picking up stuff or like eating. He might give you another way of eating that is better for the joints. For example, you may want to pick up an object using forearm. Yeah, that's one of the things. Um, Assistive devices can make it easier to avoid stressing your painful joints. Your joints are damaged, so it's typically not better to damage them even more through hard activities. So using machines would make it easier. Um, for I have an example: a kitchen knife equipped with a hand grip help protect your fingers and your wrist joints. Just simple things like just a hand grip can make it better, less stressful for your joints. Certain tools, such as the button hook, make it easier to get dressed. Catalogs and medical supply stores are a good place to look for these ideas. Just basic things that reduce joint damage. Next slide. If the condition is severe and you have to do something about it, they might mention surgery, and this is probably the final solution. Um, or if it's a severe case that you can't live your daily life, this is usually helps to restore your joints. Um, it can also reduce pain and function. Yeah. The first type of surgery that could happen is just removes the inflamed linings of the joints, the synovium, as Rayan said before. Um, just removes that part, and so that it doesn't affect, um, it doesn't continue on. And performed on knees, elbows, wrists, fingers, and hips. That's the first type of surgery. Second type is tendon repair. Usually, your tendons get damaged around your joints and tend to loosen or rupture. So your surgeon may repair your tendons around your joints through surgery. Next slide. Um, Another thing is joint fusion. Um, Surgically fusing a joint may be recommended to stabilize or realign a joint. And for pain relief, when a joint replacement is an option. Um, well, they like just put your joints in place, just align things, stabilize your joints through surgery, of course. And I would say the most severe cases, you can get a total joint replacement. You literally turn into a robot. During joint replacement surgery, your surgeon removes the damaged part of your joint and inserts a prosthesis made of metal and plastic. They use metal and plastic parts. They put them inside your joint and just basically replace your joint. Um, sur- Surgery carries a risk of bleeding, infections, and pain. Discuss the benefits and risks with your doctor. Surgery is not like something to play with. It's not normal medication. It's not medication. Medication is not something to play with, but it could be really dangerous. So it's good to see the risks before you do any surgery. Next slide. Lifestyle and home remedies. You can take steps for your body if you have rheumatoid arthritis. Um, these self-care measures, when used along with rheumatoid medication, can help manage your signs and symptoms. So there's other things that you could possibly do. First thing is exercise. Gentle exercise can help strengthen the muscle around your joints, and it can help fight fatigue you might feel. Check with your doctor before you start exercising. If you're just getting started, begin by just taking a walk, avoid exercising tender injuries. So basically, you need for exercise, your joints are damaged, so you need to make sure that you have calculated exercise. Discuss with the doctor before. It can help, but it can also damage. So there's a fine line, like there's a fine balance between them. Um, Apply heat or cold. Heat can help ease your pain and relax painful muscles. Cold may dull the sensation of pain. Cold also has a numbing effect and can reduce swelling. So basically, it's just pain removers. Just reduces pain. Athletes, for an example, um, after they exercise after a game, they either do a hot tub or a cold tub, and these things help in removing stress, reducing pain, muscle stress. Um, so these are some types of things that also can be used when you have rheumatoid arthritis. And another thing that could be used is to just simply relax. Find ways to cope with pain by reducing stress in your life. Techniques such as guided imagery, deep breathing, and muscle relaxation. Just relax. No need to. Wow. Just don't be stressed out. um, Next slide. Alternative medication that can be used. First thing is fish oil. Some preliminary studies have found that fish oil supplements may reduce rheumatoid arthritis pain and stiffness. Side effects may include nausea, belching with a fishy taste in your mouth. Fish oil can interfere with the medication, so check with your doctor first. Plant oils, the seeds of evening primrose, borage, and black currant contain type of fatty acid that may help with rheumatoid arthritis pain and morning stiffness. Side effects may include headaches, diarrhea, and gas. That's it. And Tai Chi, the movement therapy involves gentle exercise and stretches combined with deep breathing. Many people use Tai Chi to relieve stress in their lives. Small studies have found that Tai Chi may improve mood and quality of life in people with rheumatoid arthritis. So it's basically, as I like to explain it, I think it comes from China. Oh, excuse me. If I'm not mistaken, it comes from China, and I call it like I describe it as exercises for old people because old people have bad joints, usually. Um, so these exercises are small exercises that can first of all reduce stress and um, just remove the muscle the stiffness and pain. Yeah, it's just like yoga. Next slide. Coping and support. The pain and disability associated with rheumatoid arthritis can affect people's work and family life. It's a big burden, let's say. Depression and anxiety are common. These feelings of helplessness and low self-esteem. The degree to which rheumatoid arthritis, excuse me, just for one moment. All right, sorry about that. If you have rheumatoid arthritis, you need to take control and know your limits. Okay. With your doctor, make a plan for managing your arthritis. This will help you feel the change in your disease. So with constant change, you'll hopefully the mood will be better because you know there's change that's happening. Know your limits. Rest when you're tired. Um, Rheumatoid arthritis can make you prone to fatigue and muscle weakness. So taking a short nap, resting is good for your mental health. Next slide. Other thing that you can do is connect with others, keep your family aware of your feelings. They may be worried about you, but not feel comfortable asking you about your pain. Find the family member or friend you can talk to when you're feeling especially overwhelmed. And take time for yourself. It's easy to get busy and not take time for yourself. Find time for what you like, whether it's time to write in a journal, go for a walk, listen to music, just enjoy yourself. Just reduce stress. Don't worry about it. It's a normal condition. Yeah.
And here's the end of the presentation. Thanks for your attention.